My name is Dr. Rochelle Miller, and I recently made Aliyah from Chicago. I was an active interviewBambi member in Chicago, led by our very dedicated and competent leader, Vivian Black. And now I have the opportunity to continue my involvement in this worthy tzedakah here in the land of Israel. It's my privilege today to interview Bambi in the intimacy of her home about the current state of the tzedakah that she runs. And Saharayim Tovim, Bambi.
Saharayim Tovim.
And before we begin our interview, maybe you would like to send a general message to the friends and volunteers all over the world about who are involved in raising funds for interviewBambi.
So good afternoon or good evening for every one of you in all the communities over the United States, and I would like really to thank everybody to go on with the tzedakah, even that I'm not able to come to the States this year. My husband became confined to a wheelchair, and he needs me to be at home, and I can definitely not be out of the house for a week or two. It will be impossible. But on the other side of the story, the poor people are desperately waiting for our help, and it would be really a disaster for me if this tzedakah had to diminish or chas v'shalom even to close itself. So I don't know how much I do appreciate that without me coming to the States, we are going on with such mesirut nefesh. And I wish you a lot of success and siyata d'shmaya.
To begin, please tell us how interviewBambi is different from other nonprofit organizations that raise money for the poor.
So today in our country, in Israel, we have got very large kupot tzedakah, like the big kupat tzedakah, the biggest probably in Nebra, kupat Atair, which is helping also very much out on all the other cities in Israel. And this is working on a quite gigantic scale, and they have a lot of propaganda and I guess quite a lot of expenses. They're also hiring a lot of staff, which I believe makes that their expenses are a big part of the income of the tzedakah. Then, when it comes to give the tzedakah to the recipient, they have to process on a way which is a bit formal. People have to come and to fill up a form. The ladies who are working at the shelves don't know so much about the tzedakah, and things are being done very formally, not so personally. Our tzedakah is run by ladies. We do get money from men, obviously, but it's run by ladies, and all over the world, in the States, Europe, and in Israel, it's run on a very voluntary basis by ladies who have very little staff who get paid. Those who are dealing with the bookkeeping or the CPA, but even the director, the administrative director by us, Mrs. Rachel Barzel, who works out from Nebrak, she is by profession a director, general director of non-profit organizations. And for interviewBambi, she works on a voluntary basis. So it makes that our expenses are less than 3% of the donations that we are getting, and I think it's very unique. I think also the fact that it's run by women, and a lot of women are shy to come over when they have to be interviewed by men, makes it also something which is unique, and that we can help maybe more people who are in distress.
Tell us about the kinds of family that you help.
Okay. By principle, we do help people who cannot make an income due to a medical or a social problem. So that's the way we started, and a big part of our families are widows and widowers, divorced ladies or separated ladies who are waiting years and years for a get, and they don't get any support from the ex-husband. And they are with little children, not all of them have got profession, and the situation is very harsh. Then we are dealing with people who have got medical situation, like a large part, I would say, is cancer in all these forms, so long there is a need for it, because when people are in remission, Baruch Hashem, we are able to stop. Then psychiatric disorders, which is a big part of the problems, and families and where one of the parents are suffering from multiple sclerosis or Lou Gehrig syndrome. And I don't know, but I think in Israel now it became more often than it was before. I know a few families like that, and really unbelievable. With all the help of the government, the families cannot get all the help and everything that they would need for these patients. And on top of that, we have got families, we have got children who are sick. It can be something which is an emergency and will need help for a year or two, but it can also be things who are chronic, like families who have more than one child with cystic fibrosis, which is more seldom today, as a result of genetic process, and also families who have got diabetic children, some have got 2 Down children. But this also is a very, very big load for the parents. Sometimes one of the parents has to stop working. And also there are always extra medical expenses.
Can you tell us about 2 or 3 specific families that you're helping now?
No, that's not the goal. It was never. But I say that maybe in all these hundreds of families there are some husbands who are not able to be a breadwinner. There are things who just tried one job after another job, and it doesn't work. So at the end, you know, when we see situations like that and it goes for years and years, and it's not because he doesn't want, but it's just not a success. Some decide really is going to be the mother at home and she's going to work outside. Sometimes it works, sometimes it really works. But if not, we decide also to help them because the children have to have something to eat.
Can you tell us about a specific family that you've helped recently?
So we always adding some families. Every few months we try. There are also families who are dropping out because they say that they don't need our help anymore. So one of the families that we started is a family in Modi'in Illit. I know the mother because she is working in Bedamai Chayi, which is umbilical cord blood bank, and she's there, the secretary, but she's working with the laboratory. Very, very efficient lady. 4 little children, the oldest is 7-year-old. And one morning we were told that she's not coming because her husband is very sick, and we were all like afraid, in a minute, very sick. But it came to the worst. He had a massive heart attack at the age of 30, and they arrived to Tel HaShomer, and after an hour he was niftar. So here she is with his 4 little children. She wants to go on working, she is working. But her salary is reduced because she's not working full-time job now anymore. And she can't finish the month, even with the help of the government. So with our help of $500, she's able to go on. She goes to work 6 hours a day, and it really helps her to finish the month. She's 20-year-old. Very, very, very courageous and trying to make the best with her children. Another family is very sad story. It's about a young woman who was pregnant with her first pregnancy last year. And on the 5th month of the pregnancy, she got a severe case of toxemia of pregnancy with all the complications in blood coagulation and in the kidneys. And she was transferred from Shaare Zedek Hospital to Hadassah because she became a neurosurgical patient. She had a brain hemorrhage. In the middle of the pregnancy, they operated on the brain and stopped the bleeding. Obviously, the child didn't survive, and she, after the surgery, was left with a picture which is like a cerebrovascular accident. She's paralyzed half of her body. She's really an invalid. She's still not very healthy. So after all these months in hospital, the husband couldn't take it, and he decided to leave her and to give her get a divorce, which was a double tragedy on her. And she came back to her mother. Her mother is alone at home, And she takes care of this young woman, which has a big package on herself. And they definitely cannot make it with all the treatment, and they need our help.
By hearing about these families, it just shows what a difference interviewBambi can make for a family.
Definitely.
It's in crisis.
Yeah, definitely.
interviewBambi was established during the Yom Kippur War of 1973. How are the families that you are helping now, today, different from those you've helped over the past 40 years? Are they facing different social problems now?
I'm not sure. Because I remember the cases at the beginning were also cases were in the same category. Maybe the whole situation in Israel changed quite a lot. I think today people have problem with the price of the nutrition, food. Food is very, very expensive. And I hear also from American tourists who are coming to us and saying that the price of the food by us is similar to the States, but the salaries are definitely not the same. That's one thing, and I think also that housing problem become a real problem. So if young couples are starting, either if they are in a renting house and they have to pay something like 4,000, 5,000 Israeli shekel a month, which is $1,000 plus, yes, or if they buy a house and they have to pay for the mortgage, it will take at least the price of one salary. By now, young families with children cannot nearly survive with one salary. And I remember that 40 years ago it was not like that.
So the cost of things here are much higher and the salaries are lower.
Right.
How has interviewBambi evolved and changed in recent years to respond to these changes?
It may be that one of the things that we did, that we are taking maybe less people and giving more money to each family that we decide to adopt.
Have there been important changes in the government's social welfare policies? Are they increasing or decreasing support?
So 50 years ago, the government in Israel were very socialistic. After all, that was the dream of Ben-Gurion, to make a socialistic country. And slowly, it changes completely. And now we are not socialistic at all. And you feel it in everything, which depends from the government, that it's cut everywhere. It's a very, very, very big problem.
What are some of the challenges that families face today in getting help from the government or other sources?
I see that one of the main problems is when you're entitled to get something from the Bituach Leumi. Let's say you have a child with psychiatric disorders who needs a lot. Sometimes he needs hospitalization, and sometimes the family cannot cope and he needs to be in a foster family. Or if he's in his own family, it means that one of the parents probably does not go to work and they have a lot of extra expenses. Now you have to prove to the Bituach Leumi your child is really sick. But generally, if the family approach the Bituach Leumi, they will have to wait for a long time. A long time can be 1 or 2 or 3 years. And then 80% of the time they will be rejected. But you have got in this country organization who do advertisement in all the papers, and they say, we can get for you what you can't get. That means they've got a battery of lawyers, and they make the work for you, and they know how to make it because they are very good lawyers, but they take 25% of the income for 5 years. It's a very, very big amount. And I think it's not right. And people know that without taking them, they have no chance to get what they need.
I thought that Kupat Cholim covered all medical needs. Is that not true?
Kupat Cholim is something else. Kupat Cholim is the medical assistant. I think it's a very good system in Israel. I do think that we have got very good doctors and the level of medicine is good and adequate. Unless you have got something which is very, very special, then you need to go abroad. But altogether it's good. But like everywhere in the world, medication, where they are standard, are paid nearly everything. I mean, you have to pay few, maybe 100, 200, 300 shekel in a month, which is not a fortune. But some medication who are not in what they call the sal habriut, in the basket, are very expensive, especially all the biological treatment for cancer. It can cost something like 60,000 shekel in a month. How can people afford that? I just heard a friend of mine, she is suffering from hepatitis C, and now there is a new pill, and the pill is $100,000 each month, but she got it. She got it. She was mamash with a big muzzle and she got it, but this is mamash was a big surprise. But a lot of people are standing there and they can't get this special help. Also, when you need special physical therapy, hydrotherapy, not always they do agree. We have a friend. She was an ex-student of her husband and she came to Israel. She was already on crutches. She had polio when she was a young lady. And she always used to say to us, she doesn't see that she has any handicap. She's normal like everybody. She couldn't even not see that she will marry somebody who has something because she's completely normal. She's only on crutches. She was a fighter from beginning. And Baruch Hashem, she has a nice family with 5 children. I think more of them are married. But now that she's older, she needs hydrotherapy. And they will give her only once a month. I've seen the signature of 5 big doctors in the field of orthopedic and neurology, and they all say that's for her the thing that she needs. And I went till the head of the Kupat Cholim Mauchedet, and he said, nothing, I'll arrange it for you. And it was not arranged. So she was there standing, she needed this 2,000 shekel, and Baruch Hashem, we were able to help her, but not everybody has a matan beseter Bambi.
So getting that therapy really improved the quality of
completely.
Her life.
She was in such agony, in pain, unreal.